Welcome to this educational video on intestinal obstruction. Intestinal obstruction, also known as bowel obstruction, is a serious condition where the normal flow of intestinal contents is blocked. This blockage can occur in either the small or large intestine, preventing food, fluids, and gas from passing through the digestive system. In this video, we'll explore the causes, symptoms, diagnosis, and treatment of this potentially life-threatening condition. So, what causes this obstruction? The causes of intestinal obstruction are varied. Mechanical obstructions involve a physical blockage. Common culprits include adhesions, which are scar tissue that forms after surgery, hernias, where an organ protrudes through a weakened area of muscle, tumors growing within or outside the intestinal wall, and intussusception, where one part of the intestine telescopes into another. Volvulus, where the intestine twists on itself, is another cause. Gallstones, while usually passing through the intestines, can occasionally cause obstruction if large enough. Foreign bodies, especially in children, can also lead to blockage. Non-mechanical obstructions, also known as ileus, occur when the bowel's normal peristaltic movements slow down or stop. This can happen after surgery, due to certain medications, or in response to infections or inflammation in the abdomen. Sometimes, conditions affecting the nerves and muscles of the intestine, such as paralytic ileus, can impair bowel function and cause obstruction. Let's delve into the pathophysiology. When the intestine is blocked, fluids, gas, and digested food build up behind the obstruction. This distends the bowel, increasing pressure within the intestinal lumen. As pressure rises, the intestinal wall becomes stretched and swollen, impairing blood flow to the affected area. This can lead to ischemia, where the tissue doesn't receive enough oxygen. The bowel wall becomes more permeable, allowing bacteria and toxins to leak into the abdominal cavity, potentially leading to peritonitis, a serious infection of the abdominal lining. If left untreated, the obstructed bowel can perforate or rupture, releasing intestinal contents into the sterile peritoneal cavity, causing severe sepsis and potentially death. The body also loses fluids and electrolytes due to vomiting and decreased absorption, which can lead to dehydration and electrolyte imbalances. While precise epidemiological data varies, intestinal obstruction is a relatively common surgical emergency. Adhesions from previous abdominal surgeries account for a large proportion of small bowel obstructions. The incidence of bowel obstruction increases with age and with the number of abdominal surgeries a person has undergone. Certain populations, such as those with a history of inflammatory bowel disease or cancer, are at higher risk. It is important to consult healthcare resources for specific local data. Recognizing the signs and symptoms early is crucial. The symptoms of intestinal obstruction can vary depending on the location and severity of the blockage. Common symptoms include abdominal pain, which can be crampy and intermittent, or constant and severe. Nausea and vomiting are frequent, and the vomit may contain bile or even fecal matter. Abdominal distension or bloating is another common sign. Constipation or the inability to pass gas is also indicative of obstruction, although in partial obstructions, some gas and stool may still be passed. High-pitched bowel sounds may be heard upon auscultation of the abdomen in the early stages, but these may become absent in later stages. Other symptoms may include dehydration, electrolyte imbalances, and fever if peritonitis develops. Diagnosis typically involves a combination of physical examination and imaging studies. A physical exam will assess for abdominal tenderness, distension, and bowel sounds. Imaging is critical for confirming the diagnosis and identifying the location and cause of the obstruction. X-rays of the abdomen can reveal dilated loops of bowel and air fluid levels, which are characteristic of obstruction. CT scans are often used to provide a more detailed view of the abdomen, allowing for better visualization of the obstruction and identification of underlying causes such as tumors or hernias. In some cases, contrast studies, where a contrast agent is swallowed or administered rectally, may be used to visualize the flow of intestinal contents. Intestinal obstructions can be classified based on several factors. One classification is by location: small bowel obstruction, or SBO, and large bowel obstruction, or LBO. SBOs are more common. Another classification is based on the degree of obstruction: complete, where the bowel is completely blocked, or partial, where some contents can still pass through. Obstructions are also classified as mechanical, due to a physical blockage, or non-mechanical, such as ileus, due to impaired bowel function. Closed-loop obstructions occur when a segment of bowel is obstructed at both ends, which can lead to rapid increases in pressure and a higher risk of perforation. Treatment depends on the type, location, and severity of the obstruction. Initial management focuses on stabilizing the patient. This typically involves intravenous fluids to correct dehydration and electrolyte imbalances, and nasogastric tube insertion to decompress the stomach and relieve pressure in the upper gastrointestinal tract. For partial obstructions, conservative management may be attempted, involving close monitoring and bowel rest. However, complete obstructions usually require surgical intervention. Surgery may involve removing the obstruction, such as a tumor or adhesion, or repairing a hernia. In some cases, a bowel resection, where a portion of the intestine is removed, may be necessary. For non-mechanical obstructions, treatment focuses on addressing the underlying cause, such as discontinuing medications that slow bowel function or treating underlying infections. Preventing intestinal obstruction can be challenging, as many causes are not preventable. However, several strategies can help reduce the risk. Minimizing the risk of adhesions after abdominal surgery can be achieved through meticulous surgical technique and the use of adhesion barriers. Maintaining a healthy diet with adequate fiber can help prevent constipation, which can contribute to bowel obstruction. Prompt treatment of conditions that can lead to obstruction, such as hernias or inflammatory bowel disease, is also important. It is also important to exercise and move around following any abdominal surgery to reduce the risk of developing ileus. The prognosis for intestinal obstruction depends on several factors, including the cause, location, and severity of the obstruction, as well as the patient's overall health. Early diagnosis and prompt treatment improve the chances of a successful outcome. Untreated intestinal obstruction can lead to serious complications, such as bowel perforation, peritonitis, sepsis, and death. Recent research is focused on developing new strategies for preventing and treating adhesions after surgery. Minimally invasive surgical techniques, such as laparoscopy, are also being used more frequently to reduce the risk of adhesions and improve recovery times. Ongoing research is also exploring new pharmacological agents to promote bowel motility and prevent ileus after surgery. Thanks for watching, and remember, this information is for educational purposes only and should not be considered medical advice. Always consult with a healthcare professional for any health concerns.